You know that feeling when you're just buried under news, studies, all sorts of information? You want to stay informed, you really do, but it's just overwhelming.
Oh, definitely. Information overload is real.
Yeah.
It's tough to sift through it all,
Exactly, and that's what we're trying to do here, cut through that noise for you.
distill it down to what really matters. Yeah.
So today, we're diving deep into something that affects literally everyone, preventive medicine. And not just a little bit, but how it works across our entire lives, from, before birth, through being a kid, right into old age.
It's a huge topic.
Yeah.
For this deep dive, we're drawing on some really solid sources looking at preventive care in obstetrics, that's pregnancy and childbirth, then pediatrics for kids, and geriatrics for older adults.
Right. And our mission for you listening is to unpack all of this. We're talking
Yeah.
practical steps, government programs, the different levels of prevention that protect and promote health, basically from cradle to grave.
It's much more than just not getting sick, isn't it?
It really is. It's about, well, thriving throughout your whole life.
Building that strong foundation for health. So maybe we should start with the basics. What is preventive medicine, really?
Yeah, good point. Because it sounds like it's way more than just, your annual checkup or getting a flu shot. What's the big idea behind it?
You're right, it's much broader. Fundamentally, preventive medicine is about looking after the health of individuals, sure, but also whole communities, even populations. The goal is always to protect, promote, and maintain health and well-being.
Okay.
And crucially, to prevent disease, disability, and ultimately premature death. It's very proactive, thinking ahead.
So it's not just about stopping one specific illness, it's more like creating the conditions for everyone to be healthier overall.
Exactly.
And our sources highlighted something I found really interesting, that prevention isn't just one action, it works on, what, 4 different levels?
That's right, 4 levels. And understanding these really helps see how layered these health strategies are. It gives us a framework.
Okay, walk us through them. What's the first one?
First up is primordial prevention. This is the broadest level. It's about stopping risk factors from even developing in the first place within society.
How does that work in practice?
Think about things like promoting policies that ensure access to healthy food, or creating safe spaces for exercise, or even addressing big societal issues like poverty or education levels that influence health behaviors down the line. It's upstream thinking.
Got it. So building that healthy foundation before problems even start. What's next? Primary prevention.
Yes, primary prevention. This is maybe what most people think of first. It's about preventing the disease from actually starting, even if the risk factors might be there.
Like vaccines.
Vaccines are a perfect example. Yeah, they stop the infection directly.
Yeah.
But also things like health education campaigns, encouraging people not to smoke or to eat well or exercise. That's all primary prevention.
Okay, putting up that barrier. Then comes secondary prevention. That sounds like catching things early.
It's exactly that. Secondary prevention is all about early diagnosis and quick treatment. The idea is to catch a disease in its early stages before it gets serious or causes lasting damage.
So screenings.
Screenings are key here. Things like blood pressure checks, mammograms, pap smears, colonoscopies. They find problems early when treatment is often most effective.
Right. And the last one is tertiary prevention. What's the focus there?
Tertiary prevention kicks in once a disease or disability is already established. The goal here is to lessen the impact of that condition.
How so?
It focuses on rehabilitation, managing symptoms, preventing complications, and improving the person's quality of life. Think physical therapy after a stroke or diabetes management programs to prevent complications.
Okay, that makes sense. Primordial, primary, secondary, tertiary. Why is understanding these 4 levels actually important for, for our listener?
Well, I think it shows just how comprehensive public health aims to be. It's not just about fixing problems after they happen. It's about society, individual actions, early detection, managing long-term issues. It shows health is this whole interconnected system.
It really paints a much bigger picture, doesn't it? A continuous effort. Okay, let's shift gears now and look at the very beginning of life, starting with pregnancy and then moving into childhood. Obstetrics and pediatrics.
Right, because this is where prevention can have such a profound impact,
Yeah.
setting the stage early on. In obstetrics, the main aims are pretty clear. Keeping both the mother and the developing baby healthy, preventing serious illness or death for the mother, and making sure the baby has the best possible start.
And preventive medicine is involved right from the get-go, I assume. Can you give us some examples during pregnancy?
Absolutely. Let's use those levels again. At the primordial level in obstetrics, we're looking at those broader societal factors. Things like girls' education, tackling early marriage, ensuring good community nutrition even before pregnancy begins.
Okay.
It also includes things like information and education on reproductive health for young people, family planning, basically setting the stage for healthier families later.
So preparing the ground, essentially. Then for primary prevention, once someone is pregnant.
That's where antenatal care, or ANC, is absolutely crucial. Getting women to register early, ideally before 12 weeks, and ensuring they have at least those minimum 4 recommended checkups.
What happens during those checkups?
Key things. Providing essential supplements like iron and folic acid, that's usually 60 milligrams of iron, and 500 micrograms of folic acid daily for at least 180 days to prevent anemia. Also, teeter immunizations, tetanus, and adult diphtheria to protect both mom and baby.
And I guess there's a lot of advice and education, too.
Definitely. Birth preparedness is a big one, helping women recognize danger signs, planning for delivery in a health facility. Plus, advice on maternal nutrition, needing about 350 extra calories a day, getting enough calcium, iodine, and of course, counseling on quitting smoking, hygiene, getting enough rest, all primary prevention.
Okay. What about catching problems during the pregnancy? That sounds like secondary prevention.
Precisely. Secondary prevention is about early detection and treatment of complications. So regular screening during ANC for things like anemia, high blood pressure disorders, gestational diabetes, also screening for infections like HIV, syphilis, hepatitis B, which are now standard. Catching these early makes a huge difference.
And if serious issues do arise, what's tertiary prevention look like?
Tertiary prevention in obstetrics means having access to emergency care when needed, things like C-sections, blood transfusions, and it doesn't stop at birth. Good postpartum care, including checking on the mother's physical and mental health afterwards, is also vital tertiary support.
It's really layered, isn't it? And you mentioned national initiatives that support this.
Yes, there are several important ones. Programs like Patan-13 Surakshit Matritva Abhiyan, which dedicates specific days for free, quality ANC checkups, and Janani Suraksha Yojana, which gives cash incentives for women to deliver in hospitals. That's really boosted safe deliveries. There's also Lakusha, focused on improving the quality of care in labor rooms.
That's great context. Okay, so from pregnancy, let's move to the child. Pediatrics, what are the main goals there for preventative medicine?
In pediatrics, the focus is really on reducing illness and death in infants and young children, making sure they grow and develop well, and preventing long-term disabilities. It's about giving kids the healthiest possible start.
And again, I imagine primordial prevention plays a role from the very beginning.
It absolutely does. Primordial prevention for kids starts with things like promoting exclusive breastfeeding for the first 6 months. That's huge.
Yeah.
Then introducing good complementary foods at 6 months. Plus, education for parents on basics like hand washing, good nutrition for the family, and simple safety measures to prevent accidents around the home.
Building those healthy habits right from infancy. Okay, what about primary prevention for children? What are the big ones?
Immunization is massive here. The Universal Immunization Program, or UIP, is a cornerstone. It provides vaccines right from birth, like BCG, polio drops, hepatitis B, and through the first year with things like the pentavalent vaccine, rotavirus, PCV. It protects against so many serious diseases when kids are most vulnerable.
The vaccine schedule is quite packed these days, isn't it?
It is, and it gets updated as new vaccines become available, like for Japanese encephalitis in certain areas. But primary prevention is also about regularly monitoring growth. Using WHO charts, weight for age is a key one. Vitamin A supplementation is another big one, starting at 9 months with the measles shot, then every 6 months up to 5 years.
What else?
School health services are important too, things like midday meals, deworming drives, regular health checkups in schools, and ongoing education about preventing accidents and injuries.
So, lots of proactive measures. And if, despite all that, a problem does arise, or maybe a child is born with an issue, that brings us to secondary prevention.
It's exactly. Secondary prevention in pediatrics involves catching developmental delays early on. It also includes screening for congenital problems right after birth. There's an initiative called RBSK that focuses on this, and neonatal screening for conditions like congenital hypothyroidism or hearing loss, so interventions can start immediately if needed.
Okay. And for kids who have ongoing conditions or disabilities, what's the tertiary level?
Tertiary prevention provides support like rehabilitation services for children with special needs, helping them adapt and thrive. There are also specialized centers, nutritional rehabilitation centers, for children with severe acute malnutrition, providing intensive care to help them recover.
Are there specific child health programs that bundle these approaches?
Yes, definitely. One major one is IMNCI, Integrated Management of Neonatal and Childhood Illness. It combines both prevention and treatment strategies for common childhood issues. Another key program is RBSK, Rashtriya Bal Swasthya Karyakram, which screens children for what they call the 4Ds: defects at birth, diseases, deficiencies, and developmental delays, including disabilities. It's quite comprehensive.
Wow, the focus on those early years is just incredible. So much effort goes into building that healthy foundation. Okay, now let's shift perspective again and look at the other end of the lifespan. How does preventive medicine support us as we get older? Let's talk geriatrics.
Right. As we move into later life, the goals of prevention adapt, but they're just as critical. In geriatrics, we're aiming to promote healthy, active aging, prevent or manage those chronic, non-communicable diseases, NCDs, like heart disease, diabetes, cancer, and, really importantly, support functional independence for as long as possible.
And aging comes with its own set of challenges that prevention needs to address, right?
Absolutely. Older adults often face a higher burden of chronic conditions. That's a major one. Mental health is also a big concern. Things like depression, dementia are more common. Social factors like isolation, sometimes even elder abuse, can be issues. And then there are sensory impairments, vision, hearing loss, and the increased risk of falls, which can really impact independence and quality of life. A fall can be devastating.
Definitely. So, how does primordial prevention fit in here? It feels like some of that needed to start way earlier in life.
You've hit on a key point. That's the essence of the life course approach we need to talk more about. Healthy aging really does start decades earlier. But focusing specifically on older adults, primordial prevention involves promoting those lifelong healthy habits, staying physically active, not smoking, eating well. It also includes public health messages specifically about healthy aging strategies.
So, keeping up those good habits, what about primary prevention specifically targeted at older adults?
Here we're talking about things like specific vaccinations, flu shots, pneumococcal vaccine, tetanus boosters. Lifestyle advice continues to be key: nutrition, appropriate exercise, and also being really careful about medications to avoid polypharmacy, which is taking too many drugs that might interact or be unnecessary. And providing aids like glasses or hearing aids is primary prevention too, stopping sensory loss from becoming a disability.
That makes sense. And secondary prevention, what screenings are crucial for early detection in this age group?
Regular screening for hypertension and diabetes remains vital. Age-appropriate cancer screenings are also important: breast, cervical, prostate cancers, for example. But crucially, screening for depression, often using scales like the GDS, and for cognitive decline, perhaps using the MMSE, is really important. And as we mentioned, assessing fall risk is a key secondary prevention measure. Catching these things early can make a world of difference to function and independence.
And if an older person is already managing a chronic illness or a disability, what does tertiary prevention look like?
Tertiary prevention offers things like rehabilitation, physical therapy, occupational therapy, providing assistive devices like walkers or canes. It also includes support services like geriatric daycare, home-based care programs, and specialized geriatric clinics where multiple specialists can coordinate care for complex needs.
It sounds like there are specific national programs aimed at older adults, too.
Yes, there are. The National Program for Healthcare of the Elderly, NPHCE, is a major one. It aims to set up geriatric services right from the primary health center level up to district hospitals and regional centers. And broader programs like Ayushman Bharat also play a role, supporting elder care through health and wellness centers and community health assessments.
This has been fascinating, seeing how prevention is tailored to each life stage. But let's really tie it all together now. You mentioned the life course approach. What does that really mean in practice?
This is probably the most important takeaway, I think. It means recognizing that health isn't segmented into life stages. Preventive strategies need to be applied continuously across the whole lifespan. It's a continuum,
Okay.
from adolescence into pregnancy, through infancy and childhood, adulthood, and into old age. Health in one phase directly impacts the next. It's like building blocks. Neglecting one stage weakens the whole structure.
So it's not just a series of separate interventions, but one long chain of care. Can you give some examples of those links?
Sure. Think about how good nutrition and anemia control in adolescence sets a girl up for a healthier pregnancy later. That's a clear link.
Right.
Then you have the obvious maternal-child link. Good antenatal care leads to a safer birth, better newborn health, which then connects to timely immunizations, monitoring child growth, school health. It all flows together.
Yeah, I see that.
And for older adults, managing chronic diseases or preventing falls builds on health choices made earlier in life and often requires ongoing social support systems. It's all interconnected.
That really emphasizes how health builds over a lifetime. One last thing, how do we know these strategies actually work? What role does research play?
That's absolutely critical. These preventive strategies aren't just pulled out of thin air. They have to be evidence-based.
Yeah.
Epidemiology and health research play a huge role.
How so?
Well, researchers evaluate public health programs, they assess screening tests, they figure out which interventions are most effective for which populations. Our sources really emphasize this, using methods to see if programs are actually achieving their goals in maternal health, child health, geriatric care. It's a constant process of evaluation and refinement based on evidence. That's what makes public health effective.
It ensures we're putting resources where they make the biggest difference.
Exactly. It validates the why behind everything we've talked about.
Wow, this has been quite the journey through preventive medicine, hasn't it? From literally before birth through all the stages of childhood and right into supporting healthy aging. It's so much more than just avoiding sickness.
It really is. We've seen how those 4 levels, primordial, primary, secondary, tertiary, play out in real life, supported by national efforts and solid evidence. It's a truly holistic approach.
And hopefully for you listening, this helps connect some dots. Maybe you see now how different health initiatives fit together, how care at one stage links to another, and how it all aims to build a healthier life course for everyone.
It's about understanding that web of prevention that surrounds us.
So here's a final thought to leave you with. Knowing this whole framework now, from the societal level right down to individual care, what everyday preventive action, maybe something you do or see others do you now view differently? Or maybe, where do you see the biggest gap we still need to fill to achieve that goal of health for all across every generation?